I'm here in the city. I'm at Weill Cornell Medicine. I'm a physiatrist. I serve as the director of our fellowship and vice chair of the department. And I kind of got interested in regenerative medicine, kind of being skeptical. You know, I went to many different conferences, AAPMNR, different sports conferences, and everyone is citing 100% success or 0% failure. So I said, I'm going to go back to Cornell. I'm going to do research, and I'm going to publish negative data. And that was the impetus behind me getting behind this, was to prove that this crap doesn't work. So I started to do it. I started to do BMAC and PRP and various things, and patients were getting better. And I'm like, are you sure you're better? Like, how are you possibly improved when the imaging kind of looks the same? You know, the professor showed some pictures of restored disc height and T2 signal, and that's great. You know, obviously, at the end of the day, we don't treat images, we treat patients. And imaging kept looking the same, but patients functionally were improving. Their pain was going down.